Good morning, all of you, and it's great pleasure for me to again to address all of you with a new interesting topic called Samprapti and Ayurveda therapy. Generally, when we speak about Samprapti, we have a notion to understand the different stages of disease manifestation. Whenever you search in the internet the word Samprapti in Ayurveda, you get the following words what I have shown in the slides. Those terminologies are very common and very basic things in which it explains how the progression of the disease happening in step by step. In this Samprapti framework, generally we speak about 6 stages of disease. That means starting from Sanchaya to the last stage of Bheda. Sanchaya is the morbid state of dosha. That means dosha started growing or increasing in its own site, slowly started getting disturbed by some internal or external factors. Okay, so in the second stage, which is called Prakopa, the doshas which is in the morbid state, which will increase at its maximum, and it will be like a fully ripened dosha in its own site. And in the stage 3, this fully ripened dosha will start diffusing. Like in the cancer, we have metastasis. Like slowly, it will mobilize from one side to another side and start making problems. In the stage 4, known as Thana Samshaya, this dosha will localize in a very particular area, looking for its expressing. And the stage 5, which is called Vyakta, the disease, the word itself means that which manifests, or it become clear, very evident that a disease will have full-flown symptoms. When it become the last stage, Bheda, this whole things will become very specific, like complications. For example, in the diabetes, in the Vyakta stage, it is just manifesting diabetes. But the last stage, Bheda, you may have diabetic neuropathy, retinopathy, nephropathy, etc. So this is the general understanding of any disease manifestation, which is called as Samprapti. And if you are looking any disease, you are seeing one of the above stages in a case. And to explain this, there are so many textbooks are there, and even in the internet, you can see a lot of information about this. But because of that, I don't deal those things because it is available in the internet. So what I want to say is the other part of it, how we utilize the Samprapti in the management of a disease. That means how we utilize this Samprapti in the real-time clinical setup, in the treatments, in Panchakarma, etc. Because this is not available in any textbook. And I believe most of the participants here are already know basics of Ayurveda very well. I have been speaking to Russian students from last more than 15 years. So I know the level of the students, audience here. So I try to take it more deeper into the Ayurveda. So looking from the treatment point of view, if you try to understand the body, which is called Sharira, then you have 2 therapeutic zone. One is the internal zone, that is from the mouth to rectum tube, and you have external zone, that is the skin. We have 2 zones. One is the internal zone, that is from the mouth to rectum, the whole GI tube, and we have the external zone, that is the skin. For example, you have a joint pain, you are taking a pill that will go to the gut and it will get absorbed and reach to the area. Or else you take some medicines or an oil, you apply locally. So you have external method, also internal method. So the external method is largely depends upon the stimulus response. That means you apply some oil or you apply some powder, it will stimulate through the skin and different gunas will go deeper and start affecting it. But whereas internal is the response by transformation. Transformation in the sense you take a pill for the joint pain, but Agni, the digestive fire, will transform that pill into what it is needed, and with the help of Agni, you transform it. So if you look into the internal area, this is very interesting. So then we understand how the Samprapti become very significant. So this internal area is called kosta. The gut is called kosta, and it has its own pharmacokinetics. You already know what happens when we take a food. It has different rasa, then it may have guna, then vidya, vipaka, even the prabhava. So in the transforming response zone, where based on different rasa, guna, vidya, etc., a drug, a food, whatever, it will respond according to the need of the body. Yeah. In the kosta, the rasa, guna, vidya, etc., will become very crucial. That changes the drug or food how to behave according to the need of the body. Here, generally, rasa has a great role to play. Vipaka, which is very active because that is the post-transforming content. Whereas guna, vidya, prabhava can be active, but many times it can be passive also. When it comes to the external therapies, especially the skin pharmacokinetics, vidya is the biomarker. That means when you apply something externally, it may be a paste, it may be a powder, it may be an oil, where the vidya and guna has larger role to play than vipaka. And again, the kosta, understanding of kosta, can be in multiple level. It can be a cellular level kosta also. It can be like an organ. Kosta can be an organ, or it can be a system, totality. Or the whole body can be also be considered as a kosta. That means kosta means that which is a receptor of things from outside. And when we try to understand this kosta in its physiological level, three things become very significant and which has a great role to play in Samprapti. One is Agni. Of course, we all know the role of kosta, the digestive fire. Second one is the Shrotas, that is the channels which takes things here and there. And third one is Ama, that is the undigested situation. Of course, you all know very well these terminologies, Agni, Shrotas and Ama, I believe, because this is a larger frame. We already spoken about this topic many times. But the same kosta also have multiple meaning. One, it is a gross level, that is called stula entity, gross level, and sometimes we also have a subtle level also. That's why I put this picture, and gross and minute, you can see in the picture, two persons. And when we look into understanding this gut in the context of Samprapti, this is very interesting that the role of kosta is to transform things. Yeah, the role of kosta is to transform things from one situation to another situation. For example, I am taken food just now, so the food is heterogeneous to me. That is not, this is called ama, temporarily. And my Agni will do the transformation of my food. Then food will become homogeneous. It is called pakwa. That means the role of Agni is to transform or change heterogeneous to homogeneous. And that is why, while defining kosta or the gut and the context of Samprapti, they told that every transformation there will be different outputs. So we have transformed circulatory output, that is called dhatu, and we have transformed excretory output called mala. And when it comes to the whole transformation, it is very interesting that body try to transform in a different form. like in the liquid, solid, or gaseous level. Suppose if I take a food, my food is transformed into a liquid exchange. The water content of that food is changed into different, and it also have solid exchange, and it also have gaseous exchange. This is very crucial. Suppose if we take a medicine, so that medicine is undergo transformation with the help of Agni, depends upon different stages of the disease. Some situations we can give medicine to the kosta, it can get transformed and absorbed, but some situation it cannot. So such situation happens, then we have to find alternative way how to stabilize this transformation. For example, a disease, and I'm given a medicated ghee to that person, and after taking the ghee, person says that, doctor, I cannot feel good, I feel very heavy, I feel very tired, I'm not having any appetite, etc., etc. What does it mean? That means that Agni has a crucial role to play to change things how it is, and change what is to be made according to the need of the body. Again, this transformed response even vary from different situations. So this is very important in Samprapti. Generally, every day when we take food or water, Costa has a general response. Then we have specific response with the help of medicine. For example, we are giving some medicine to the gut. Not necessary to be very aggressive, but it starts responding in a very specific way. Then we have challenge response. That means you are challenging the Agni. For example, in a Snehapana, that means you are taking medicated ghee every day in a higher level, not eating food, only medicated ghee in a peculiar method. Then that is a challenge response. Then we have Rasayana, that is also, suppose we are taking a particular type of Rasayana, then we have particular type of diet, and we are doing some challenge response. And lastly, we also have another response called threaten response, mostly happen due to the poison. Suppose if I taken something poisonous in my food or something way, then my body has to respond very quickly to, I should get a vomiting sensation, or I should have a diarrhea, whatever different way my body should respond. This is very important in the context of Samprapti, because in different stages of the disease, you have to choose a different type of things. So we have to assess the situation of the dosha. We have to assess the Samanavata, Pitta, Kapha, etc. And based on the subdoshas, we'll come to a conclusion. If you look at this picture, you see a bottle of rum, a glass of ice, and a small boy. So normally you may get confused. Did this boy is already alcoholic, got alcoholic, or something not? But it is a bottle of glass of his father. So what I want to say is that don't get prejudiced. Okay, this is this. No, not prejudiced. Try to analyze what is happening. So in different diseases, when we have a Samprapti clearly, you have a different assessment in a different levels. The level 1 is you plan or you predict that, okay, I'm given this medicine in this stage of Samprapti, so I'm going to get this type of response. Here the accuracy is generally poor, but as you become more and more experienced person, accuracy becomes better. The second one is you just give a test dose and wait for the response, where accuracy is better. And the third one, which is assessment follow through, that means you give something and keep on observing what is happening to that intervention. So here accuracy is much more higher and very much personalized. And now in these transformed responses, there are many determinants which makes this become good, bad, or poor. Because the prakriti of the patient may different, age group, type of food, especially different cultural, regional, national, tropical. There are so many changes of the food also influences in the transform response. And it also influenced by emotional, behavioral nature of the person, also the habit like alcohol, tobacco, etc. Even the medical intervention too. Many interventions like even surgical or psychological intervention also have a very great influence in this transform response of the koshta. So this will be very, very interesting. When I do the Kaya Chikitsa program, we have a different system of diseases like cardiology, nephrology, neurology. We will try to discuss these things in detail with the prescriptions. What are the best prescriptions, etc. in that full program of the Kaya Chikitsa. So keeping on this background, we have to understand these 6 stages of Samprapti. And in that Samprapti approach, we have innumerable method of therapy. But for understanding and learning purposes, there are at least 18 approaches in the therapy. So here, I will try to see today these 18 things, very, very interesting. This will get an idea how complex Ayurvedic intervention can be based on different stages of it. Because normally people think that Ayurvedic management means, okay, you give this medicine to this. No. You try to understand the whole Samprapti in choosing what is the appropriate method of intervention in that given case. So the first one is Hetu Viparita. That means your intervention is opposite to the cause of the disease. For example, there was a rain. For example, yesterday there was rain here. So I just went out of the rain without umbrella and I get wet. And if I get wet, maybe in the evening I may get a fever. So the treatment is I should take some ginger water because I exposed to too much cold, too much shita, dreva, etc. And my idea is to stop against the disease course. Here, most of the time, we'll be using home remedies, not real drugs. Materials what we have in our house can be used as a medicine opposite of a disease cause. For example, somebody is telling, sir, I have severe burning sensation in my eyes. So I'll tell the patient, okay, you do one thing, you take some milk, you pour the milk on the inside the eyes. Because burning sensation is something related with pitta. And I'm thinking something reduces pitta. That is, the milk is very good to reduce pitta. So I just prescribed, and it's also very good for the eyes. Similar way, based on the etiological factor disease cause, we can have opposite type of food. This is one of the very important aspect of Ayurveda. During any disease progresses in the Samprapti, you will find an appropriate food according to the manifestation of the disease. Suppose a person had a fever and that time the digestion is not good, so better to have some soup, not very heavy food. And this food can also be igniting the Agni and getting out of this disease problem. And Ayurveda medications not only includes food or things, it also related with the activity. Suppose a person gets fever and he didn't had a proper sleep in the night, so he can sleep in the daytime. Yes, what is written in the slide is the opposite. I'm going to tell that. That means if you have a fever in the night and you didn't get the proper sleep in the night, so he can sleep in the daytime. And the other way, also sometime a vata aggravation happens in the daytime and fever originates, then you don't have to sleep in the night. You have to awake a little late to get out of that problem. So that is one set based on the causative factors. Then another set is the management of Ayurveda in the framework of Samprapti based on the disease specific. So, for example, a person is having diarrhea, then there is a plant called Kutacha, Hollerania antidysendrica. The word itself is, the scientific name of the drug plant itself is antidysendrica. And diseases opposite food. So Vyathi Vipirita. That means find appropriate food opposite of the disease. For example, person says I am having gas problem, I am getting burping, belchings. Okay, in the food you add more fennel seeds. They are very good in making vata downward. Similar way, Vyathi Viparita Vihara, that is disease opposite activity. There are so many activities we can do which is against the disease can bring good result. For example, many times people will have shortage of vitamin D and we ask them to have a sun exposure properly. Because if we expose sun properly, it can increase our immune system, it can improve our digestion, improve our liver functions, and many, many more. Traditionally in Ayurveda, a lot of spiritual practices are there. In different diseases, we do many, many things. Now the next category is the cause plus disease opposite. Cause and disease also both are opposite. Like cough and edema, the Shamula is an established that will be good for cough as well as good for edema. Here in this intervention, we are looking both from the cause point of view and also the disease point of view. The next category way of method is called Hedu Vyadhi Vipirita. That means both cause and disease opposite food. You choose appropriate food. A person saying that I have irritable bowel syndrome and he says that he has abdominal pain, indigestion, etc., etc. So here we are addressing both the dosha level, because with the help of buttermilk, you can control the dosha as a causative factor, also control the disease also. So here the condition, for example, person feel very drowsy and sleepy because yesterday night that person doesn't slept very well, then he can sleep in the daytime. That is the Hetu and Vyathi method. So these 9 categories, so based on Hetu, Vyathi, and combination of Hetu Vyathi, we have 9 categories of method of administering some therapy in a person. The next 9 out of 18, next 9 is opposite of what we already spoken. For example, in this case, we are chosen always opposite. But here, similar will be handling the situation. When we are playing in the ground, suddenly we got an injury in the hand or leg, but no external abrasion. So you take ice piece and apply there. Already Vata is dominated it due to the injury, but still you're using a high Vata material like an ice and treating it. So this type of method is called Vipiritarthakari. Another one is, you see, based on the Hetu or the causative factor, food is not opposite the disease. When you have a wound, it is under healing, we are giving pitta-aggravating food because it can grow fastly. For example, already you have a sore throat and with the hot water, you are gargling. Already sore throat and with the salt water, you feel irritated, but you'll get result also. Yeah. If you have a sore throat, you take salt water for gargling and you feel better, because salt water is also pitta aggravating, but in this special situation, this is beneficial. So now the Hetu Vipiritarthakari Viharam, that is activity, is not opposite to disease cause. Olden times, when there are different bipolar mood disorders and all, there was a technique called giving shock. That means electroconvulsive therapy. Nowadays it's not in practice, but there is a tradition, because this increases the condition, but it brings result. 13 category is, this is a medicine not opposite to disease. So you give a particular medicine, but with the help of that medicine, you try to heal it. For example, a person is vomiting and you give medicine for vomiting again. The patient will say that, doctor, I want medicine to stop the vomiting, but you are giving medicine and I'm vomiting more. But in reality, that vomiting is due to ama, and that is why we are giving medicine for vomiting, so that let the ama get completely gone out. So many situations where we have ama is there. For example, a person is having diarrhea. Again, we'll give medicine for diarrhea, loose motion, because he's having ama type of loose motion. So let the ama go out. This means that, for example, a milk is given in the diarrhea. That means already the person is having loose motion and milk is not good. But it is because of vata, and if you give milk, it will be very beneficial. Similar way, activity not opposite to disease. That is another level. For example, a person is feeling nausea and vomiting, but vomiting is not coming properly. So you are taking finger in your mouth and touching the oropharynx or the palate and inducing the vomiting. Similar way, hetu vyadi combination. So you have both causative factor, that is the particular dosha vata, also some manifestations of disease. And for example, over exercise, you have done a lot of exercise and vata aggravated. So you do swimming, so it is it also looks like vata increases, but it's not. Also help the person to get relaxed. Similar way, annam, that means food or drink, not opposite the cause of disease. That means very similar to disease. That means in an alcoholic case, you are giving wine or arishta in the patient. Here we have many options to balance, and this is similar. There are different alcoholic situations, so we have different type of arishtas. You give in a particular dose and it can bring good result. And lastly, the Heduvya Vibridatari Oushadam. That means you are using a medicine not opposite to the cause and disease. For example, you are using heat, particular Ushna medicine in the Ushna situation. This means that it's not that always Ayurvedic management is opposite to the causative factor or the disease, but it can be similar way also. Because of these reasons, Ayurveda has a lot of options in the management of different diseases. If you meet 5 Ayurveda doctor and take prescription for your same disease, there are possible that this 5 prescription can be different from different, one from different. So you may be surprised how this is possible, because different 5 people understood that disease in a different levels of depth. Another 3 important things in the Samprapti and therapy is the Atma Manas Indriya axis. Just like in conventional bioscience says about HPA, hypothalamus, pituitary, adrenal axis, Ayurveda has AMI axis, Atma Manas Indriya axis. Yes, just like in modern bioscience, we have HPA, that means hypothalamus, pituitary, adrenal axis. Whereas Ayurveda also has similar axis called Atma Manas Indriya axis. Okay, this means that whenever you handle a disease, there are sense organ has its own role to play, Manas also a role to play, Atma or the karmic cycle also have some role in deciding the treatment. So considering all these possibilities, the treatment can be innumerable way, because the Samprapti can make innumerable combinations. The more and more complex way of Samprapti, then we have more and more complex framework of management. It's not the name of the disease. If you get the name of the disease, it's just nothing. But the more and more, if we know the complexity, the networking, internal connections in the disease, that become more and more easier in defining the treatment. So, but for academic purposes, for learning purposes, we classified therapy in six-fold. So we have classifications like Langhana, Brahmana, Swedana, Stambhana, like that. So these are called six-fold therapies based on different manifestation. But some has an opinion that we can have only two, all other can be included in this two. And in this therapeutical interventions, we also have, beside medicine, there are many other words also comes in the scene. We have to look for the ahara, that is the food and eating habits of the persons. We have to correct there. We also have to look at the achara, that is the lifestyle and behavior. We also have to correct there. We also have to correct the vihara, the activities, maybe personal activities, exercise, or the work pattern. And another important thing, we also have to adjust or correct the person's thoughts and emotions. So it becomes very complex. And Ayurvedic therapy, in a deeper way, it is a play of opposites of gunas. So imagine you have a chessboard, you are playing with white color and the disease is playing with black color. So the black color put a movement. Okay, this is Ruksha. Then you put a white, this is Snigdha. So like that, the whole treatment is like a chessboard where you are playing and trying to win over the disease. The king of that chessboard is the Atman, the soul of that person. So don't get checkmate. So if you get checkmate, then you die. And the queen in the board is the Manas, which is has to be capacity to move everywhere. So keep your Manas very strong. So understanding Samprapti means you play with all the gunas. And this can start with the logical treatment, then it go to the psychological, even the spiritual level. So what I mean to say is that the more and more you know the details of Samprapti of any disease, any given conditions, your treatment become more refined, precise, accurate, and clear. In my Kaya Chikitsa class, I am going to address different systems like respiratory system, cardiovascular systems, etc. And I will try to elaborate all the best possible way, which is not available in any of the books. I try to took 2 or 3 major conditions in that system disease and try to explain the whole Samprapti so that most of the disease in that system can be managed in this understanding. So in that, I try to give best Ayurvedic therapies, home remedies, what are the frequently appearing disease with its prescriptions. So I request all of you to join that Kaya Chikitsa program, that is internal medicine and therapies in this program. In that Kaya Chikitsa program, you will have a elaborate conversations on different diseases, neurology, cardiology, nephrology, urology, gastroenterology, etc., like that, very detailedly. So by these words, I close here today's my promo, and I'm looking forward all of you to see in that Kaya Chikitsa program. And I really appreciate the wonderful translation by Alex again. And I also invite all of you to join me physically in my arrival in Moscow. Most probably, I'll be in the Moscow program in the April 7 to 13 in 2025. So I'm looking forward to see you all for personally in this program, as well as in my theory of internal diseases perspective of Ayurveda program in Kaya Chikitsa. I once again appreciate all nearly 300 participants. There are around 60 people in online, and I appreciate all of you for joining in my sessions. If you have any questions, please let me know. Yes, of course. Online course will structure the program in a different way where every disease and its method is spread. When offline, when I'm coming directly, I try to elaborate with case studies. I try to bring many cases, videos, photos, and explaining how this disease is managed in best practices of last by 30 years in different systems. So I have a lot of photos, videos, my hands-on experiences, best prescriptions. That is the main highlight when I come personally in Moscow. Yeah. I'll answer. I got it. The question. I got the question. There are many aristas are very powerful in correcting the my mental status, and in that way, aristas as a medicine, it can reduces the alcoholic challenges. There is available in India, but there is it is called Matuka Sava, Matvarishta. These are some of the products used in India, even in the cases of alcohol. So thank you very much for all the participants, and I hope you are really enjoyed my sessions today. Looking forward to see you soon.